The number of cases in China increasing to 77,000, including 2,400 deaths, followed by Japan with 840 cases and 4 deaths, then South Korea with over 830 cases, including 7 deaths. Also, Italy quarantining some areas as it faces the first major outbreak in Europe, reporting more than 200 cases and 5 deaths. And in the Middle East, Iran with 43 cases and 12 deaths. Infectious disease specialists like the Cleveland Clinic's Dr. Frank Esper are analyzing a new report detailing the first 72,000 cases. He told CBN News the virus spreads through droplets.
We think that most times people are being infected when they are coughed nearby in a 6-foot radius or so, or sneezed in a 6-foot radius. It aerosolizes in that small area for a very brief amount of time. It is not like SARS. SARS was airborne. Measles is airborne. That's where the virus can lay around in the room for 2 hours, waiting for someone to inhale it. This coronavirus is not like that. It is mostly you have to be in the same room, in the same close proximity with another individual to be infected.
Eastern Virginia Medical School infectious disease Dr. Edward Oldfield says new information about people who carry the virus make it more difficult to control.
Now we're finding there's significant amounts of virus in the nasal passages and the oropharynx, even in people that have no symptoms.
That includes people who've already recovered from it. The good news, a vaccine and treatments possibly within months, fast-tracked because of COVID-19's similarity to SARS, a coronavirus from 17 years ago.
The protease inhibitor Kaletra had activity against SARS. They've already started a study in Wuhan. There's another experimental drug called remdesivir, and they've also started a study with that.
Experts say expect more deadly coronaviruses unless China deals with crowded, unsanitary markets where wild animals are sold and slaughtered, the kind where both SARS and COVID-19 reportedly first transferred to humans. Meanwhile, doctors say right now Americans should still be more concerned with the flu.
This is probably the worst flu season in a decade. It started with influenza B. Right at the January of 2020, it started dropping down, so we thought maybe it was going to be a short season, and then it came roaring back with influenza A.
The CDC reports 16,000 flu deaths in America so far this season, including 105 children. Pat?
Well, Laura, you mentioned this COVID-19 and SARS. They both started from animals to humans. What is it they do with those markets that's so unsanitary?
Well, Pat, bats are the originator of SARS, MERS, and COVID-19. According to scientists, bats carry about 400 coronaviruses, and because of their immune system, they don't get sick from them. But they do sometimes pass coronaviruses on to other animals, which are then sold at these markets. They're called wet markets, and wild animals are sold to thousands of people. Remember, Pat, Wuhan is a city of 58 million people, 11 times the size of New York City, and they're often butchering these animals on cutting boards and then putting other animals on them. In other words, the viruses can spread like wildfire. With SARS, the Chinese government closed down these wet markets, but then opened them again after it passed. Now with COVID-19, the Chinese government shut down the wet markets, but have said that after this COVID-19 scare passes, they're going to open them again.
Well, Laurie, what can science learn about this coronavirus by looking at other viruses in the same family?
There are 7 coronaviruses in humans. 4 of them, Pat, are actually part of the common cold, so they're very mild. The other 3 are MERS, SARS, and COVID-19, which all have higher death rates, and they were all passed to humans from bats to other animals and then to humans. And so there are 3 of these new coronaviruses that are more serious than the first 4.
Well, now, somebody that wants to prevent getting COVID and the flu, what would you recommend?
Actually, they're both both transmitted the exact same way with droplets. So the main thing is to wash your hands with warm soapy water for 20 seconds. And also to, when you cough or sneeze, do it in the crook of your arm or also into a Kleenex.
Are you worried about this stuff in America? Or you think influenza is still a much more serious virus, right?
Well, the CDC says that we can't expect more COVID-19 cases in the United States. Our healthcare system is ready for it. That there are all kinds of precautions already in place across the country in case it gets to more serious conditions that we're seeing in some other countries. But our healthcare system here is so good, and a lot of experts say part of the problem in some of these other countries is they weren't adequately prepared for it.
Thanks, Lori.